Are you ready?
Yeah.
Yes!
This is the Ross Kaminsky Show.
You're a great American.
He's a great guy.
Now, Ross Kaminsky on Denver's talk station, 630 KHAL.
I guess I'll say unfortunately, like almost everything these days, things are becoming political, which really shouldn't be. Such as a discussion about whether schools should fully reopen and have in-person education, or they should stay closed for a while and do the virtual thing, or do some kind of hybrid. And all the politicians are trying to make hay out of it. I'm going to avoid the politics. You know why? I've got school-age kids. I care deeply about my kids. I also care about their teachers. I also care about the other people who work at the school, whether it's the principal, the janitor, security guard, all of them. I care. And I care not just about the health aspect, which is tremendously important, of course. At the top. It's at the top of the list. But I also care about everything else regarding my kids. Are they learning? Are they socializing? Are they having fun? Are they just sitting at home bored, staring at a screen? Are they falling behind in the things that will impact the rest of their lives because they're not in school? And of course, a lot of the driver towards the right answer, or perhaps right answers plural, because it might be a little bit different in one place for another, does have to do with the question of, or multiple questions of, coronavirus and children. So I saw a very, very interesting piece just published in the journal Pediatrics entitled COVID-19 Transmission in Children. The child is not to blame. One of the authors for this very interesting piece, Dr. William Raszka, is the director of Pediatric Infectious Diseases at Vermont Children's Hospital, and he joins us on our VIP line this morning. Doctor, thank you so much for being here.
Thanks for inviting me, Ross.
Let's start with the headline. Do kids spread coronavirus?
Can they spread coronavirus? Yes. Are they less likely to spread coronavirus than adults? Yes. One of the things that we have not quite understood about COVID-19 in children is why they tend to develop infection less commonly than adults, why they develop less severe disease than adults, and why they seem to be less likely to transmit disease than adults.
Are they less likely to transmit it even if they have it? Let me word that. Let me make sure I word that correctly. If 100 adults have it and 100 children have it, even putting aside the fact that the children seem less likely to have it, are the children less likely to spread it to as many others as that same number of adults would? And if so, do you have any understanding of what the mechanism for that is?
So it's a complicated question and would have to do with attack rates and where we are discussing that. Is it in a household or is it in a school? And the data would suggest, if we look at attack rate information that was acquired from China and other places, and we look at the case reports that and case control studies that were done in schools, that children do seem to be less likely to transmit the virus.
That's very interesting.
So there was a French child early in the pandemic, had co-infection with influenza and COVID-19, and had multiple contacts in a school, didn't spread it. In New South Wales, there were a few children in the school system, and the adults that had contact with 750 people. Maybe one high schooler acquired infection from another high schooler, but just not being transmitted. In a French elementary school, 3 infected children in February did not infect anyone else. But I have to be really cautious here when we talk about children, Ross. Children spans a really wide range. So the children that are least likely to transmit the infection are the youngest children, as far as we can determine. I'm a little more cautious talking about high school students. Even if you look at your Colorado data, only about 2.7% of cases of COVID in Colorado are in the 0 to 9 group, but it jumps to 6.2% in the 10 to 19 group. So we have to be a little more careful on those high school students.
Interesting. Yeah. So, I mean, and that does make sense if there is a straight line or something like a straight line correlation with age and either transmissibility or infectability. So that makes sense.
Maybe for a variety of reasons, and I think it's reasonable to think there's an age-related phenomenon. So the Centers for Disease Control no longer says age 65 is the cutoff for increased risk for severe disease. They simply see age is a criterion for increased risk of severe disease. So if you're 50, you have a greater risk of severe disease than you're 40. If you're 60, you have a greater risk of severe than you're 50. So they don't just say it's 65 and it's like on or off phenomenon. Presumably in children, because of a variety of issues, whether or not they're as susceptible to infection because of specific receptors in their body, whether they can, cough as forcibly as adults can, or whether they can breathe as much air in and out at a single time. That will all lead to transmission dynamics or changes or differences in transmission dynamics.
Do you have kids?
I do. 4 of them. Can you imagine?
Are they school-age kids?
Only one is in graduate school right now. I'm 60. But nonetheless, my partner in infectious disease has school-age children. Yeah. And, because we get asked this question all the time, would I send my children to school? Actually, my niece, who lives in Colorado, who lives in the Denver area, called me the other night and said, should I send my kids to school? And by the way, we have extended family there, one of them's entering high school. Should they go to high school? And I actually said to my niece, yes, that schools need to put in processes and procedures, policies to mitigate risk for everybody, and that they're all working on that. And I liked what you said at the top of the show when you said there's no right answer. There are several right answers depending on what's going on. But when those are put in place, I'm very comfortable sending children to school.
So do you think that there's all this conversation about is it safe for the teachers? It's safe for whoever? Do we have to spread the kids out? Do we have to keep half the kids home on one day and then the other half kids home on another day? And all these kinds of things. Is your sense, and again, we're talking about, since we're talking about data, we're sort of fundamentally talking about the average or the median here, and there can be outliers on one end or the other. But is your sense that if a teacher kept and other staff kept enough distance from the kids, that maybe we don't need to go too crazy separating the kids from each other, because that would present such massive logistical problems for schools that you really couldn't have normal schooling?
So the way I've approached this, Ross, is to think about what are the easy things to prevent transmission. I'm a huge fan of facial cloth coverings. I really think the data is compelling that they help prevent transmission. So I think everyone in the school, wherever possible, should be wearing facial cloth covering. Critical in high schoolers that I think students entering high school absolutely should be required to wear facial cloth coverings. And I do think that we should put into policy that even younger children should be wearing masks. In Vermont, we built that into the school reopening, that everyone wears masks unless they have a medical contraindication or developmental issue. The teacher should be wearing masks. Those are simple things. That absolutely helps prevent transmission. To make use of outdoor spaces, staggering start and end times. These are avoiding congregation in large groups inside. These are all things that can be relatively easily done to help prevent transmission. The spacing is, of course, a big issue. The original Centers for Disease Control recommendations was try to keep 6 feet apart. Since they made that initial recommendation, there was an article that came out in a really well-respected journal that said maybe 3 feet would be pretty good. And so the American Academy of Pediatrics said, well, try for 3 feet. Those are things we can do. There isn't a hard stop. I'm really cautious about saying, if you cannot do this, schools cannot reopen.
Right.
You blend things. You say, what can we do? Can we make sure the windows are open? Can we have some classes outside? Can we stagger the start time? Can we make sure everyone's masking? Can we do effective screening? Can we make sure that no one ill enters the school system? Those are all things that can be done. that can help parents feel that it's safe to send their kids to school and help adults in the school system feel safe there as well.
One quick tangential question. I'm engaged in a little online debate with the governor of our state regarding masks. I do tend to wear a mask when I go out, although we don't have a lot of requirements around in the places that I go. I wear it anyway, primarily out of politeness to other people. My question for you is your best analysis of the best data that you've seen. Do you believe that the primary benefit of masks is to prevent the spread coming out of the person who's wearing it versus the effectiveness of non-N95 masks, just the cloth stuff that most people have, or the little cheap surgical masks, of blocking a virus from coming in? You understand my question?
Of course. So when we talk about masking, we're really talking in the community about facial cloth coverings, because we're not generally recommending that people in the community are wearing surgical masks or higher level protection. Mm-hmm. And when we are talking about that, we are absolutely using that model to protect others. So if I'm wearing a facial cloth covering when I go to the grocery store to pick up my vegetables, I'm wearing the mask simply to protect other people. Because if I cough, I have no symptoms right now, but if I actually have COVID, I might develop my symptoms tomorrow, and I'm infectious today. Mm-hmm. So I am telling everyone in the community around me, say, I am protecting you by wearing this mask, and I'm hoping that you will wear a mask so that you'll protect me. The mask, those facial cloth coverings, are not doing much to protect the individual wearer from particles. They don't do a very good job at that. Mm-hmm. If you start wearing a surgical mask, one of those things with the pleats and everything and multiple layers, right, that not only are you preventing transmission to others, that is doing something to help prevent the wearer from becoming infected.
Right.
The N95 masks, which we do not recommend wearing at all in the community, generally speaking, really are very effective at preventing the wearer from becoming infected. So that's what we use in the hospital when we're taking care of patients who are COVID-19 positive or have tuberculosis.
Mm-hmm. And so, it seemed... finish your statement. Finish your thought.
So in the schools, what we're recommending is that at least in Vermont, what we're recommending is that all the students in the school should be wearing facial cloth coverings. The teachers and the adults, we would also recommend facial cloth covering, but potentially they could use something else. They might want to use a surgical mask, or because they're adults or other procedures as well. But everyone should have something over their nose and mouth.
Okay, that makes sense. And on the surgical mask thing, I don't want people to get overly confident about the benefit of surgical masks either for protecting you from particles that might be around you, because I mean, a lot of those masks, depending on how you're wearing them, can be kind of open at the sides, and then it doesn't matter how good the material is in front.
Oh, absolutely. If it's not worn correctly, it's not going to work. I see people all the time, they have it, just over their mouth and their nose is sticking out. Yeah. That's not particularly helpful. So you just, as with anything we do, you should wear it appropriately. And if you wear it appropriately, it's going to give you the maximum benefit, or give the people around you the maximum benefit. But again, masking is in conjunction with other measures that, hopefully that you're not congregating in large groups of adults. If you get 50 adults in a small room, boy, that's sort of a higher risk situation there.
My special guest, Dr. William Raszka, is the Director of Pediatric Infectious Diseases at the Vermont Children's Hospital. Now, your new article that you co-authored with Benjamin Lee, COVID-19 Transmission in Children, would I be correct to describe this as sort of a meta study?
Well, it's a commentary. And so I'm an associate editor for the journal Pediatrics, and there was an article published in that issue that looked at the transmission dynamics in children in Geneva, Switzerland, and said, where are these kids getting their infection? Did they get it from other kids or whatever else? And they did contact tracing, and they found that in over 90% of the time that the children had gotten it from an adult contact. And so that was consistent with all other household contact data that had been published, whether it was from China or anywhere else. And it was consistent with national data, say from Norway, where children didn't seem to be transmitting the disease to other children, particularly under the age 10. So we looked at that data and we said, what inferences can we make? How can we apply this to something that's really important to everyone? And we said, it's really interesting that children don't seem to be transmitting the disease very well. Maybe we can use this as a basis for jumpstarting the process for opening schools to allay some of the concerns. Now, we're not saying that they can't transmit it, but they're much less likely to be infected in the first place and much less likely to transmit it. Let's get a conversation going to say, can we get kids into school? Because that's really essential. That's an essential part of their development.
And then and we talked a little bit about this already, but you looked at other studies that were similar. I noted in your piece and elsewhere, the Australian one, 9 students and 9 staff infected with COVID across 15 schools, had close contact with 735 students and 125 staff. And only 2 secondary infections were identified, none in adult staff. 1 primary school student was potentially infected by a staff member, and 1 student in high school was potentially infected. So those transmission rates in schools, in that case and some others, really, really low. And I don't want to get overly complacent about this, but as a parent, to me, the multiple downsides of not having my kids in school are so high that with this commentary of yours, it pushes me with even more, I won't quite say certainty, but confidence towards saying schools should be open.
So I'm a proponent of schools opening. I think that they can be open safely. There are going to be different opportunities or challenges in different school districts to how to make that happen. So you can imagine that there's a lot of concern in, say, certain Florida counties about how to do this, and the concern will be greater in high school students than in younger students. But the data to date has been encouraging. So the data in Western Europe where schools were opened, they have done very well. It's like in the Swedish experience, I don't think there was a single transmission in elementary school children. There was potentially an outbreak in high school. Again, we don't know the dynamics of that, whether it came from the community. In Germany, they have done very well. They just published it's a pre-pub that just came out this past week about they weren't seeing an uptick in infections at all, and they weren't seeing increased numbers of infections in students based upon testing their blood for evidence of infection. But, the Jerusalem experience said, well, we had a big outbreak in a high school. So, again, we think, and all those countries had sort of relatively low background rates. But overall, when you look at that data, we would say, particularly for younger children, there doesn't seem to be much transmission in school, if at all, essentially in these really young children, and that there can be ways to open schools. As the children get older, you have to think more carefully, what are the things we can do to make sure everyone feels safe? Because remember, once you get to these 18-year-old children, young adults, or whatever, teens, they're bigger. They might potentially transmit, just like the cholera did. There's more infection in that population.
And my last question for you, I need a sort of quick answer on this, if you could, Doctor.
Sure.
As a doctor, as a parent, as a citizen, how do you feel about how, at this point, you can almost predict what somebody will say about whether schools should open or not if you know their political party?
I hope that we all share the same common interest, and that is that we want to do the best we can for our children, and that we want to do the best we can for everyone in our community. And that's a way to ground us and work together. And I don't think we should enter any conversation with preconceived notions. And it's a conversation.
Dr. William Raszka is the director of Pediatric Infectious Disease at the Vermont Children's Hospital. That was a fabulous conversation on a tremendously important topic, Doctor. So thanks so much for your time. I really appreciate it.
Thanks for inviting me. I enjoyed it immensely.
We'll be right back on The Ross Kaminsky Show.
This is Denver's Talk Station with Ross Kaminsky now, Michael Brown at 2, 630 K.